My name is Preeti Haymeyer, and I have spent the past 5 years at the Bill Lane Center for the American West as its associate director. I recently transitioned to a new role at Stanford in the president's office, helping launch the Office of Community Engagement. But when I think about my time at Stanford, one of the greatest highlights of working at the Lane Center is the opportunity to work and interact with wonderful scholars and students like the two you're about to meet. Phil Polikoff has more distinguished titles than I could possibly share. All of you received his bio as part of the event program. Most importantly, today, he is an affiliated scholar with the Bill Lane Center. When I think about Phil, he's trained as a doctor and as a scholar, but most importantly to me, Phil really is a doer, and I hope that comes across today when you learn about the work he's been engaged in. Phil and I have been working together since 2016 when he really catalyzed the Lane Center's work on rural health. We held a wonderful convening in Santa Fe, New Mexico that focused on identifying critical issues and innovative solutions to the challenges facing rural populations, particularly when it came not only to health, but healthcare and access generally. This led us to a very important gathering that built upon that work, thinking about collaboration and compromise in the rural American West, and we gathered with a group of scholars in Yakima, Washington. And since then, Phil has launched several exciting endeavors that he's going to talk about today. All of these are housed under a nonprofit entity called A Healthier We. And today he'll tell us more about A Healthier Rural America and his call with his colleagues for a national institute specifically targeting rural populations. Um, we're very fortunate to have with us today one of Stanford's current students, at the moment a virtual student, who we hope to welcome back to campus next quarter. Alan Huang is a senior at Stanford studying computer science and biomedical informatics. He is born and raised in Hattiesburg, Mississippi, and has been part of Stanford's alternative spring break program ever since coming to Stanford. Now, the alternative spring break, or those of you in the Stanford community know we love to shorten things, ASB, is a 1 unit winter class that allows students typically to travel or participate in an active service learning course between the winter and spring terms. This year, Alan is co-teaching that class. He'll tell us a little bit more about his history with it. It's called Just Corn and Cows, Bridging the Rural and Urban Divide. Students look at patterns in the rural urban divide across the United States, and this year they're focusing on Mississippi in the South, looking at these issues through a historic, social, and economic lens. Alan was first a participant in this alternative spring break, journeying to rural Illinois with his classmates and learning about health disparities in rural America. His goal is to explore these issues with fellow students and raise awareness of these issues that are often overlooked by a largely rural student body at Stanford. So today it looks like our full registration is getting closer and closer. As we're about to transition to the actual program, a bit on our format. We're going to start off with Alan, who's going to talk about this alternative spring break class and his personal interests in rural issues hailing from a largely rural area in the South and what the class is covering. Our aim is really to make today as interactive as possible. So we're trying something new. Bear with us. We hope the technology works. But we have a series of questions for you, the audience, where we'd love to get your take before Phil shares his presentation on the future of rural health and the call to action. And then I have a handful of questions that I'd love to ask Phil and Alan, but really this is about you all and your interests and how we can bring some interesting voices from the Lane Center and Stanford community to you on such a critical issue in the middle of this pandemic. So with that, I'm going to turn it over to Alan. Alan, we'd love to hear a little bit about you and your time at Stanford and share more about the alternative spring break.
Yeah, pretty. Thank you so much for introducing me. As you just heard, I'm from Hattiesburg, Mississippi, which I don't consider to be a very rural background, since it's considered a huge city of 40,000 people, at least in the state. And but then after coming to Stanford, I quickly realized that it's not very typical for city people to drive by cow pastures on the way to work or on the way to the Walmart and things like that. And so coming to Stanford was quite a culture shock for me, just in terms of just like people who were not familiar with like real issues. And I know there's a crazy statistic that about only 4% of Stanford students come from rural backgrounds, which is quite different than the 20% of the entire US population that comes from rural backgrounds. So I became really interested in this issue sophomore year when I joined the ASB program that went to rural Illinois. And so one of the co-leaders back then was a 5th generation farmer. And so we went to her hometown and got to visit and interact with many of the local leaders there. So we saw live like calf births. We got to talk to the local superintendent, the mayors, the insurance people. And then so it was really interesting just seeing the challenges that part of rural America was facing and the struggles that they were trying to do in terms of keeping population, trying to like keep education going and get funding from the state. And so for the past 2 years, I've kind of continued leading that program, exploring the rural urban divide. And instead of focusing on rural Illinois, I've been teaching a winter quarter class that's kind of been focusing on the rural South and rural Mississippi, which I'm more familiar with. And so we cover issues such as like rural health, the rural economies, rural poverty, and information access in the forms of broadband, internet, education, and legal access. And then normally we would have a trip to Mississippi planned over spring break, but unfortunately, the COVID-19 pandemic has prevented that both last year and this year. But at least like I think our classes had good engagement for the past 2 years, so I'm excited about that. And I think it's just good that we're having more people kind of engage in these issues.
Great. Well, thank you so much, Alan, for that preview. And we're looking forward to hearing a little bit more about what you and your classmates have been learning through the alternative spring break. All right, Bill, the floor is yours.
Thank you so very much. It truly is a pleasure being here today with you, the audience, the Bill Lane Center for the American West, and even Alan, because I've had the privilege of working with his class. My history goes back about 5 years with Stanford at this duration. I was there earlier in the 80s in the med school, and I'm very pleased to say that it's been a real honor to be associated with the Bill Lane Center for the American West, as well as a consulting professor at the med school. And what's even more special is my experiences with Preddy over these 5 years. The show that we put on in Santa Fe was just one of the special moments of my life. It was highly successful, highly engaging, and we made some progress in the state of New Mexico, which is going forward with the current leadership within that state, including Senator Bay Ray Lujan, the newly elected senator. With that, we have a lot to cover. We want this to be engaging. We want it to be lessons learned. And it's a story that has a past, a present, and hopefully a more viable future, because there are many challenges in front of us. So let us go through the slides reasonably rapidly. Please take your questions and ask them to yourselves and make sure we hear them in the Q&A. And then we'll go forward. And as I say, this is a start, not the end. We're very committed to seeing the evolution of a healthier rural America. It's time for a rural renewal or a rural renaissance or rural transformation, whatever you want to do. It has to be significantly transformed to a more dynamic, active, prosperous state than it currently is. So let's look at our first slide. The first slide is the definition that goes back in history to 1948, which was put forth by the World Health Organization. It's been moderated a little bit or adapted, but for the purpose of this, rural health is a state of complete physical, mental, and social well-being for one and all, and not merely the absence of disease or infirmity. What's important here is the word health. Many people view health more in the model of illness or health care. That represents probably about 10 to 20% of the load factor, but probably about 80% of the cost factor. We forget that there's a genomics or a genetic part of this, and we certainly forget that there's a social determinants or other words that are coming into play for that, blind spots or disadvantaged communities. So we really have some challenges to broaden the definition of rural health that includes one's housing, one's transportation, one's access to broadband, and more. So we'll get into that as we go forward. But this is the old definition that's become more convenient to important as of today. Next slide, please. The facts, and there are many more here. Currently, 60 million people, approximately 20% of the American population, lives in rural America, which represents 40% of our geography. With this goes along that there are many blind spots, places that need help, whether it's Appalachia, the Mississippi Delta, which Alan's been talking about. It could be the mines of Wyoming, and it can certainly be the migrant farm fields of Central Valley in California. And with this, there are significant problems associated with the current state. Right now, there are 172 rural hospitals that have been closed since 2005, with additional clinics that have been closed and nursing homes that have been closed. And it's not closing down. Interesting enough, on this statistic is the highest rate of closure are in the states that did not choose to increase their Medicaid availability to their residents. So you're looking at problems in Kansas, Texas, Mississippi, Arizona, and on and on. There's a real shortage of rural healthcare workers as well as rural workers in general. There's a great lack of sufficient numbers when it comes to migrant farm workers helping the agricultural industry. Broadband and internet, a vast majority of people in rural America don't have access to strong enough broadband. It's still heavily run by teleco companies, so it really has to be expanded. We're seeing hope in this area. Starlink is now putting out satellites that are getting into more parts of rural America. That's a great hope for the future. With this, we need more broadband, and this also enters into the whole issue of where virtual health is going forward in the future. Right now, with COVID-19, we certainly have seen that it's impacted the hardest in rural America. The states with the highest mortality per population are North Dakota, South Dakota, Mississippi, Arizona, and Texas. There may have been more deaths in larger states, but the amount of burdens put on. And who has been most at risk in the rural states? It's been people who resided in nursing homes, who don't have access to get to a larger facility in a very short period of time. It's people who are working in the meat processing plants. It's people who are working in the whole area of emergency medical services. So there's a whole bandwidth of people in rural America. And also don't forget the incarcerated or those who are living on reservations. The Native Americans have been hit very, very strongly, and the amount of support for them is minimal. They've had a hard time getting short-term preventive help, whether it's masks or social distancing or knowledge on that. They're having a hard time getting treatment at hospitals that can do it. For a while, they were overwhelmed. And more recently, they've had trouble getting vaccines in a timely manner. So as Alan was talking about, the rural-urban gap does exist. More attention is paid to the urban areas. More resources are in the urban areas. Philanthropy has dedicated more of their resources to urban issues. And it goes on and on with all the crossing, what I call the crossing of the divides. There's a whole issue of racism. There's a significant percentage. 20% of people living in rural America are people of color, and they're not getting the resources. An interesting statistic also is when you look at costs for what the government pays on people. The average American who's on Medicare has an expense of $14,000 in financial resources available to them. Those who are veterans have $10,000 available to them on an annual basis. And those who are Native Americans have $4,000 available to them. And there was a promise made to Native Americans many years ago that they would receive appropriate health care, which has never come to reason. So let's go on to the next slide. So moving forward, why take action now? Laying the groundwork, what do we need to do differently today? And focus on fundamental actions. And you'll see that change from my perspective is not easy to come by. Hopefully we can move from past to future and get away from this red-blue line, which is creating issues in rural America. We have to come to some commonality and a non-partisan approach to making one and all better off. Next slide. There was one slide that had here, I'm sorry we don't see it, on the chaotic nature of our current state. Currently, just before we get this, the current state is really very challenging. Right now, in the US government, the federal rural programs are in 400 different programs. They're located in 13 different departments, 10 independent agencies, 50 offices in some agencies, and getting through in the legislative process, it's 14 legislative committees. So right now, it's very chaotic and not very inefficient and effective. Hopefully, and this is the dream that I share with you, we create a different mechanism. We find a bipartisan approach, which is funded by legislative action, more so than executive orders. We have it starting at the top, where Biden knows what he's doing on this issue, delegates it to the Domestic Policy Council, and from there, there's more empowerment and interaction between the Department of Agriculture and the HHS, Health and Human Services. And with that, it then goes into a new organization, which would be known as the National Institute of Rural Health. So this is a vision. It's not a reality yet. But with this, it has to be based on, and from this reality, it would then go through the state to give them better sources of knowledgeable information and research. And then it would go into rural communities, rural residents, and rural businesses. So that's the dream that we're sharing with you today. And we're on our way to making this dream, hopefully, a reality within our short period of time. With that, we have to consider foundational actions to be considered. Better health must include a stronger focus on poverty, quality, equity, environment, prevention, accountability, and satisfaction. So this, going through almost the questions that you were asked to respond to in the beginning, have to be looked at. We have to have better access to health care. It's a civil right. It should not be a privilege. It should be a right for one and all. Right now, unfortunately, access to care got some strength through ACA, but the whole issue that was better care, better health, and personal and consumer satisfaction is still open for question. We must examine the new role of digital ecosystems. So somewhere there's a balance between human interaction and data. Data is critically important, but you still have to be seen not as a transactional interaction, but more as a relationship interactions. Words matter, action matters more, and what matters the most is very strong relationships at all levels. So with that, the next slide, please. We need to find new ways to identify and use our whole rural health workforce. That means you have to go from top down to bottom up, but probably more importantly, you got to go bottom up to top. It's got to be integrated and interactive. There has to be a role for community workers, especially now that we've seen with the COVID-19 pandemic. We have to make sure that they see each other as playing a role, whether it's your social worker. We need more prominence of mental health. There's always been a history in agriculture where mental health has always been a stigma. There's always been sort of a negative framework to rural America also. So we have to make everything much more positive and inspiring. I like to use 3 words recurrently: spirit, hope, and energy. Without this, we cannot see meaningful, positive transformation. We also have to find the next era of leadership. Some of us are getting a little old. Someone just told me I was in the 4th quarter of life, whatever that means. I'd rather not be there, but that's where I'm at. So we have to make sure that people who come from a rural background are given the empowerment to stay in their communities and help back. There's a significant degree of out of rural migration of the youth. So that has to change. We also have to make sure that the 3 largest employers are held accountable. The largest employers in rural America are healthcare, 1, government and education, 2, and agriculture. And we have to empower those who own their small farms to stay in business. Many farms have gone into foreclosure. So it's a very dynamic period of time for people who really pride the beauty of our country, which is rural America. Interesting, another fact for you to take away is that in rural America, 96% of the residents are either animals that are cultivated animals or humans. Only 4% are wild animals. That's not what it used to be. So we have to preserve the quality of our nature and think about the impact that climate change is having on the rural environment too, through floods, droughts, or fires. That has to be part. There's all interactivity between many of these issues. It seems complex, but I think it can be better audited, accounted for, and acted on. Next slide. So with this, it's a lengthy slide, it's a run-on sentence, but nevertheless, it says what it has to say. The citizens of the nation, along with the healthcare systems, patients, providers, and payers, must address all areas of how people live, where they work, what they do as far as remaining healthy. There are many places in rural America that are known now as food deserts. Likewise, there are medical deserts. You cannot get appropriate food and appropriate health care. Schooling, it's getting really hard. The virtual model of schooling is challenging at all levels, from pre-K through high school, through whatever. And keep in mind, probably the best investment we can make and where we spend our money is on our youth. We get a better ROI dealing with our children, especially the younger ones, to make sure they don't get ill, whether it's mentally or physically or socially, before they evolve into their teenage years. So this is what's going to be engaged as we deal with a healthier rural America. And we could say just for a healthier America, but we're primarily focused on rural America. With that, let's go to the next slide. So going forward, that's what we're trying to roll into this National Institute of Rural Health, but it can stand on its own merits. We need a new focus on leadership at all levels. We have to use the best of the 4-H or future farmers of America. We have to use our state institutions, whether they're land grant or other state institutions, to train the next generation. We have to make sure that our state officials are more resourced given to carry out the needed supply chain to get back to their constituents. So there's a whole bunch of leadership that has to come in to this that makes the change from the past, the current, to the future. With that, let's go to look at some specific initiatives before we open this up for conversation. Public health, that's what I trained in early on in my career. And with that, there's a great spirit if you went into public health. I had the good fortune of being a U.S. Public Health Commission officer with the new organization called the National Institute for Occupational Safety and Health. I want to only ask any of you participating today, how often have you heard of NIOSH or OSHA in the last 30 years? How often have you heard CDC in your own community not only giving you data, but action? How often do you see that it's become so political? Last year, when the need for public health officials was quintessentially the most important thing, many of them either left their jobs or fired from their jobs for political reasons, bipartisan. I can tell you states that were Democrat, where the head of public health left the job, or Republican. That's not acceptable. Our training isn't as easily available for people to train in public health. So we have to have a greater focus on supporting our local health departments and also having the local health departments interface with the clinical practitioners in the town. We need more support and we need to do actionable research. Digital, we already talked about, expand our rural broadband, integrate it into healthcare. Telemedicine is here. However, there are challenges in it. Do you know the quality of the care you're getting through telehealth? Do you know what you have to pay for it? Do you know how your provider views it? Do you know if one provider of dermatology is talking to your general practitioner about what they find? So where does collaboration and where is competition? It happens with the health systems. They're merging. Is bigger better? Or do you need to keep community facilities open? Where does the large consumer stores in the community play a role? Whether it's a Walmart, a Costco, a Best Buy, or an Amazon. How are you getting your products delivered? Ironically, in some places, the drone is delivering the products to your house. The first place that was ever done was in Rwanda, which is in Africa. That's changed. Now it's gone into North Carolina where it's being delivered. So digital becomes important. Next one, please. Economic incentives, rural regional partnerships. Right now, like you saw with COVID vaccine distribution, one state competes with another. That's not a healthy model. Certain places where there are healthy models in Washington, Alaska, Idaho, and other states have come together in their medical training. Rural cooperative models, like you saw with the Rural Electrification Administration, is a way of dealing with making sure something's done in a more appropriate way and making sure there's enough capital. There's definitely need to seniors because one of the major issues for seniors is isolation and depression. It also happens with the problem with addiction, with opioid addiction. And in the younger people, unfortunately, there's a high rate of suicide, a higher rate of suicide in rural America, as well as there's a higher rate of traumatic injuries from cars in rural America. This has to be dealt with. Insurance initiatives, we have an opportunity now to enhance ACA and make sure the rural voice is listened. One of the things I've learned most in the last couple of years is that trust and transparency are critically important, and the ability to listen with a quiet voice is really imperative. So with that, hopefully our insurance initiatives get to be more holistic as a right, not a privilege. Next initiative, please. Rural health workforce initiatives, we have to deal with the training from start to finish. We may even want to give rural students, if they're willing to commit for a couple of years, some free healthcare tuition, like we had with the Peace Corps or AmeriCorps for additional resources. And then we come to environmental initiatives. We really do have to address this as part of rural health. It's a critical part of moving forward with a positive way. How do we deal with air, water, waste pollution? In the South, there's an association with a lot of wastewater and the communities they live in, which are poor communities. And we've seen this when we're looking for success stories. We've seen success stories throughout the country, whether it's in the South, where there's Black communities like Orangeburg, or in the Hispanic communities like Espanola, New Mexico, or in the white older communities like Ord, Nebraska. They've all come up with ways to look at their issues, audit their needs, prioritize them, communicate, have an open forums, and find new leaders to take on these issues and make them sustainable, positive results. Last slide on this section on future initiatives. Entrepreneurship, rural job training. We have to train people for the next generation of jobs. It's home working is both positive and negative. It's certainly changed where people live. Those with more affluence, many have moved out of urban environments to more rural environments, whether it be Aspen, Sun Valley, Jackson Hole, Lake Tahoe. However, at the same time, many of the rural people have moved into the urban environment seeking out new jobs. There's a role for the land-grant colleges as well as the state universities, whether it be a land grant like Cornell or a state school like Eastern Tennessee State University. And then we move on to the last initiatives, policy center initiatives. We have to mandate a National Rural Health Institute, and that's where we're trying to be part of the genesis of this idea. We have to make sure that academia, business partnerships, public-private partnerships get involved, and that we identify the local assets and the needs. So as I said earlier in this presentation, so we stay on time, it's top down, bottom up, maybe better yet, bottom up, top down, and involve all the key players, whether it's civic, faith, philanthropy, business, and we can go on. So there is no shortage of opportunities, but I would say think globally, act locally. So make this granular at a level that you can see successes within a definable time period. Moving on, before we close out, moving forward, we must address, maybe amplify, these are what I call the 5 Ps. Places where people live and work, your personal health, how are you looking after your own health status and improving upon it, better food, better exercise, better housing and all that. Population health, that we know the numbers that exist in any community, whether it's a higher rate of chronic diseases, which is the case in rural America, higher rates of cancer, diabetes, heart disease, opioid addiction. Public health, we've already talked about it. Public health has to have more people engaged, a stronger foundation for it. more interaction at all levels in the community, whether it's infectious disease, whether it's environmental issues, whether it's housing, transportation. We do have to have a greater presence in public health. And then the political will. And that's really making sure that our leaders at the local, the state, and the federal level have the will for change, and working with them closely, listening, help prepare legislation, help prepare policy, what we call the 3 Ps, which would be policies, politics, and practicalities. And of that, I think the strongest word is practicalities. How are we going to make something that's tangible? Research is great. There are great institutions that do very aggressive, positive research, but let's put that into an actionable state sooner than later. So if we know that air pollution is having problems, let's clean up the air as well as better define it. It can be on telehealth. What is it doing? What is it done? So everything should be looked at with objectives and key results as a part of any initiative that we take on. And hopefully this leads to prosperity and health and takes us away from illness and poverty. So with that, let me leave you with one closing line, which we've used before, and then we're going to open it up for questions. And I think we're on schedule, Freddie. So the last slide, which I think is pretty important and symbolic of the times. In these times, if I is replaced with we, that's all of us today and others to be included. Even illness will become wellness. We can only work towards a healthier rural America or America together. If all we do is have divides, political divides, economic divides, spiritual divides, emotional divides, racial divides, then we're in big trouble. So it's the time for us to make a pivot in a positive directions collectively. And it really has been a privilege to spend this time with the attendees and the participants. And hopefully we can engage all of you in working towards solutions and paying less attention to redefining problems. We hear a lot about problems. It would be nice to get, so most of what we're doing is sharing stories that talk about positive solutions to critical challenges.
Wonderful. Well, thank you so much, Phil. I did want to see if we could pull up the results from the poll earlier before we go into some questions. Can everyone, I hope everyone can see this. So the first question, which of these needs which of these needs are most important to be amplified for a healthier rural America? And it looks like political will really tops the chart. Prioritizing the importance of the initiative for rural renewal to come alive. Similarly, broadband access underpinning all of this, community and economic development, leadership. And finally, which of these is most important to you? Better health by quite a margin. Phil, anything before we go into the questions? Phil or Alan, anything from these results that surprised you?
No, I think they're right on target. I mean, I can't see the last ones, but I do believe that we really do have to have political will. All the other ones are very, very important. They're all very personal, but unless we have a society where everyone feels that they're a part of it, not an exception to it, we're going to have some problems. When it comes to broadband, it's a here and now issue. The other ones are equally as important, but unless we get the broadband established sooner than later, and make it more of a federal orientation, it has to be more than just broadband for healthcare. It has to be broadband for all the social issues that we have. And it has to be a public-private partnership to make it work effectively, in my opinion.
Great. Alan, anything to add on the poll results?
Yeah, I'd just like to add that like broadband access is, I think, like in many ways, kind of like the foundation behind many of the other things that need to be improved. Like, so for example, a lot of like economic development is hindered by lack of like broadband access, and obviously like virtual health and things like that as well.
Absolutely. Great. Well, with that, I do want to start with just a few questions. I encourage the audience, if you have questions for Phil and Alan, please just type it in the chat in the bottom right. Phil, maybe we can start. We're approaching the 1-year anniversary of shelter in place and the pandemic. What lessons excuse me, what lessons have been learned with the pandemic, particularly and its impact on rural America? The rural communities were able to stave it off a little bit longer than some of the urban areas, but maybe you can reflect a little bit about the pandemic in rural communities and what steps you see as vital for moving forward with this institute to address the needs of rural communities at this moment.
Well, as I learned overseas in part of my education, your question is better than my answer. Uh, it's and also timing doesn't permit one to go into incredible depth. You have to start in the beginning where we're at. We had public health issues prior to the pandemic. We had issues of lack of enough personal force, lack of enough trained people, lack of integration between the clinical practitioners and the public health community. Then it all got um, overwhelmed. The people were in denial about the impact that the COVID-19 virus had, and it got more and more. They were in denial that it became that doing prevention became a political issue, not a public health issue. Whether you wear the mask or not, and keep in mind some of the places that are now reopening the quickest are also in rural America, Wyoming, Texas, um, some others, Mississippi. So there you run into a problem. You have to train the people so they trust the messenger. That wasn't done well. The healthcare facilities were limited in rural America. The lack of emergency medical services, the hospitals in A were not strong enough. They didn't have enough ventilators. They did not have the proper medication, so they couldn't transport them to B in a larger city because they were already full. Then the vaccines, the messaging was all over the map. Operation Warp gave us a great product in a shorter period of time, but then there was no national focus because every state had its own ability to talk about the distribution. And then there was a supply shortage. And then there was the Texas problem with the weather issue. So we learned a lot. This is not, maybe, hopefully, we won't have a similar pandemic, but we're not sure this one's over. We have the concern about the variants coming in from the UK, from South Africa, from Brazil, maybe even from this country. So we have to make sure we continue to do the research, make sure the data is in place, make sure we hold the right prevention in force a little longer, but understand that people have challenges with the education process here, or the economics of it. It's very challenging, but the leaders have to be somewhat consistent and show a team approach. I don't think you need just one person speaking out to an issue in a state. It would be nice to have a team. I'm not picking any one state. I don't think the governor alone is enough of a voice. He should have the team, or she, the team around him, that speaks clarity on the issue and understands the impact the issues is having on their total population. And making sure there's equity. It's a big, strong word. Who has and who doesn't? It's unfair to have more given to the affluent and less attention to those in need of resources.
Thank you. And with such a big topic like this, I think it's hard to wrap your head around it. Phil, in your remarks, you mentioned several times the importance of young people, of youth, and education. And I wonder, Alan, maybe we can turn it to you, and you can share a little bit about what you see as the role of Stanford students in particular in helping shape the future of rural America, and share a little bit about what your classmates and students in the alternative spring break have been reflecting upon related to rural health.
Yeah. So there's currently, for undergrads, there are some public service opportunities for students in rural America. These are through programs such as the Cardinal Quarter, where students can spend like an entire quarter in different orgs with different orgs in different parts of rural America, and just gain like a quarter of experience working with them. And then they can choose to continue that like for additional years or post-graduation by applying for grants and things like that. And obviously many Stanford students will become like future corporate policy or public service leaders. And so it's pretty important, I think, for them to kind of gain a sense of how they can help shape the future of rural America, just by like being able to change the different policy considerations, or by adding opportunities, by increasing broadband internet access, or simply trying to like add jobs to the local economies. And I think in terms of our students, what we've been grappling with are kind of more like what Stanford can do to kind of help promote more people from rural backgrounds from kind of even knowing that Stanford is an option for them. Since I think one consensus we have in our class is that a lot of people from rural backgrounds kind of look at places like Stanford and think like, oh, like that's not for me. Like I couldn't go there. And even if I could, like, why would I want to go there? And so I think it's pretty imperative for students like that to try to like help shift the mindset so that they can kind of understand like, okay, like I can go to Stanford and I can use the resources at Stanford to help kind of give back to my local community when I'm done graduating or things like that.
Great. And maybe you can share a little bit, what do you think are some of the key learnings, either from this alternative spring break or prior ones, about rural health in particular? Anything that has been particularly eye-opening? I know we've talked about just the mismatch between the general population and its representation that are rural and its representation at Stanford, but any key things that have really stood out to you from participating in the class and now teaching it?
Yeah, so I think in terms of like rural health, I think one part that's been really eye-opening is just the sheer number of hospital closures in rural America. This was something I really wasn't aware of as much, since it wasn't like none of the things, like it wasn't really happening close to my hometown. So just kind of learning about like the scope of it was really shocking, and how like it really affected communities who were unable to like kind of get accessible healthcare after the closures. And another thing is just the diversity of rural America. So like a lot of it is struggling, but there's also areas that are like doing relatively well, such as like Los Alamos in New Mexico or Dodge City in Kansas. And political will is also a very interesting thing because it's also very different across different parts of rural America. Obviously, the stereotype is that places tend to be like quite conservative and and that's how they spend their money as well. But there's a lot of rural places, especially in like the West Coast and the southern border, that tend to be like quite liberal. And for example, like one of my students, my class comes from a family of rural lumberjacks in Washington, and like her family was so liberal that they were actually once investigated by like the FBI for communist ties. And so that kind of just shows how like different communities kind of prioritize, like kind of internalize the values of independence differently, I think. Yeah. And then another thing is just I saw there was a question about like the different definitions of rural America. And so I think like looking at that can kind of change the way you like contextualize rural struggles, because there's many different definitions of rural in the government. So the OMB has a definition and the census both have a definition. And then their definitions are both just basically anything that's not rural, anything that's not urban, which is kind of a vague thing. Like the census actually doesn't define rural. But yeah, so there's a lot of challenges with even trying to understand like rural health and rural issues, just because a lot of the more like successful rural stories, they stop becoming rural places actually, and they often kind of become suburban or urban environments, and they kind of get out of the data, if that makes sense.
Thank you. Phil, anything to add about the definition of rural? We have some great questions coming in from the audience.
No, I think Alan hit it right on the spot. There are many, many definitions of rural. Some are size, some are location, some are distance from A to B. Some are in the space between an urban environment and a true rural. How rural are you? I think there is an issue of identity. Being rural has had a negative framework. It's always presented as the people in rural America are older, poorer, and sicker. That's not the total case. It's an important part of the puzzle, but not the only part of the puzzle. And then there's the beauty of rural that doesn't get expressed as much. So the people in the urban environments on the East or the West Coast, you hear that story over and over again. East Coast, West Coast, and the Midwest is sort of ignored, even in the political dynamics. Who goes and deals with it? On the other hand, some of that is self-fostered because they keep their same way of leadership, which is not very eclectic. It's privilege. It's privilege in the sense that it's for a specific subset of the people who live there. It's not for the universe of people who reside there.
Thank you both. The next question comes from our own Felicity Berenger, who asks about the growing number of pharmacy deserts in the rural West and wants to know, perhaps maybe we can start with you, Phil, what are some of the best ways to remedy this problem in the era of corporate consolidation of pharmacies like CVS?
Well, I have great respect for the person who asked the question, but I don't want it to be a recorded response knowing her success story. Uh, in all reality, there are different ways. There are the large corporations that are now going into telepharma. So it's coming there. Two, I think the issue is also a national issue, not just a rural issue of how are we going to have regulations and cost control on the drugs. Three, how much do we open up our borders to drugs, the generic drugs from Canada or Europe that are priced at a different rate? Four, how do we look at the drone new technologies, a way of maybe distributing pharma medication to people so they can order it in at a different price? So I think that's a great question. The answer is going to have to take more of a posture of discussion. It has to be put out there, and it can't be seen as a one shoe fits all, because pharma fits into the whole issue of other apps that are out there. What's the data? What's the story? And how do we make it so it's a clearly stated story that how you get your medications is critically important? And what's the quality of the medication you're getting? And what's the checks and balance if you should have an issue with your medication? Because right now, if one watches TV, all they're seeing is a plethora of new drugs on the marketplace. Doesn't matter what the issue is. And the question is, do you get it through a clinician who knows about it? Or do you have access to the clinician knowing about it? On the other hand, you can go the other way slightly. Can't we have pharma have higher responsibility? It's like right now, many of the pharmacists or people working in the pharmacy are giving the vaccine. So how do you expand the scope of practice of a nurse or a medical assistant to meet the needs of the population if they don't all have access to general practitioners?
Thank you. Our next question is about the seriousness of the shortage of broadband and internet connectivity in rural areas, and how would increased internet access improve health in those areas?
Well, and then Alan can put it. Alan, why don't you chime in first and share your thoughts as a person who's into computer science?
Yeah. So I will say, I believe the statistic is that about a quarter of rural residents do not even have access to broadband internet. And even among the people who do, many of them still do not subscribe to it. So that's around like 15 million people in rural America without, who like don't have a provider that even offers broadband in their local area. And then like many million more who just don't subscribe to it just because they're kind of used to the way that things have always been and they don't feel a need to do it. And I think that so in some ways, like the adoption of broadband can be more important than simply having the access, because even if you have access, people won't always subscribe to it. But I think the adoption of like better internet access can improve health just by like having more economic opportunity that would bring along more income and like a better, more vibrant community. And that could just kind of raise the population health as a whole.
Phil, anything to add?
No, I think Alan's done that. As far as telehealth, it certainly came of age with the pandemic. We've learned a lot about it. Turns out that on a personal basis, people are more comfortable with telehealth than the practitioners. Many practitioners don't particularly like telehealth because it lacks the human interaction. It lacks total transparency on the person. There's a question of what's the reimbursement rate of it. The question is the volume of activities you do on it. So right now it's evolutionary. There's a lot of entrepreneurial interest in telemedicine, a variety of different companies that have started. And now you have the whole issue of AI, artificial intelligence. Some people call it augmented intelligence. Where does it fit between data and human interaction? My belief, speaking just for myself, technology is part of the solution. It's not the total solution. And when you're dealing with human interaction, that's in many cases more important that the person wants to look at Alan and Preddy in the eye, and they want to see your smile if you're going to give me a smile. Or Alan, are you paying attention, right? So that's a human interaction, because a lot you can learn just by looking at a facial expression. And if it's all just audio, you don't get that pulse. So I think there are many, many cultural transformational issues we're experiencing now. I know we're all hungry, literally, to eat out, to go out, to be entertained, and less to be confined in in a secluded space. So it's a changing times. I have lived through many different periods of time, and this one is uniquely different than even the 60s.
Well, Phil, here's a softball question for you from your colleague, Dennis Behrens. What should a new rural public health model look like in a holistic paradigm? We only have 7 minutes left, so maybe maybe a high level answer.
Well, I think it should have a higher priority at all levels. It should have more resources dedicated. It should have more roles and regulations. It should be at a higher status from the federal all the way down to the community or vice versa. It has to have proper staffing and a proper mission. It has to be integrated into the overall health delivery system, however you're defining that. So it has to be integrated with population health, public health. Their voice has to be heard in the political circles, and they have to have less politicization of the basic needs to take care of the issues. So we're on the road to re-enhance the status of public health from when I started to where I'm at.
Anything you might want to chime in there, Alan?
No, I think Phil kind of addressed it like perfectly right there with like the importance of just kind of increasing the public health.
Well, I guess there's one thing that should know the public and even Mr. Burns when he asked the question. Right now, we're spending $3.5 trillion a year on health care. We're spending almost 20% of the gross national product on health care. When it comes to public health, we're spending less than 3%. So that's a big gap. 97% of our expenditure in healthcare is not being spent on public health. I think there is a role that it can go up significantly more than 3%.
Surabhi Balachandra, also from the Lane Center, has a comment and a question saying she appreciates how you included incarcerated people in the framework of rural health. Phil, can you speak more on how you see incarcerated people fitting in and what initiatives could be targeted to that specific population?
Yes, I would like to see more preventing people from being incarcerated to start with, to understand the communities, the issues that are going into it. Many people, from my own experience, were incarcerated because of drug abuse or lack of family dynamics. So we have to deal with infrastructure issues, not only dams and roads, but we have to deal with the family or cultural infrastructure issues to prevent it. When they are incarcerated, they should be treated wisely with a sense of empathy and try to be rehabilitated sooner than later and have them play a role in their evolution through the penal system. Because we definitely, and we don't have to privatize the incarceration system. That did not work. We have to make sure they get proper care and make sure they don't have access to drugs, whether it's amphetamines or fentanyl. So it's a holistic approach of prevention first, lack of incarceration, make sure incarceration's less time with more empathy, make sure there's rehabilitation, and the tougher cases should be dealt with in a tangible way, but I don't know the way it's been treated over the last period of time is the right way. The death penalty. So that's a challenge, but there certainly can be done better. We have a long ways to go incarcerated. There are too many people incarcerated in the United States at two costs to those who are not incarcerated, because I don't think it's preventing making for a better society.
Well, in the last few minutes we have, I think we started on a personal note, understanding what drew Alan to these issues and how he got involved here at Stanford. Phil, our dear friend and colleague, Professor Bob Siegel, wants to comment on what a great presentation and ask you more about the genesis of your passion for this particular issue.
Well, it's a cycle of life. So to make it real quickly, my first degree was in agriculture. My second degree was in environmental engineering. My third degree was medicine, both trained in this country and overseas. And the fourth was in public health, and then public policy and communication. So when I got the opportunity coming to Stanford and sort of quote unquote recruited by the Bill Lane Center, it showed me that there was an opportunity to pull the pieces together in a holistic manner, and there's a real niche that needs help. And at this stage, having the good fortune to be able to have some freedom of movement, I have the passion and the purpose to see change. And we're seeing it, by the way. We're seeing it. And some of the people who are even on this video, I know, are part of the change process. So I'm excited. I'm challenged. It's a little bit more effort than I thought, just expenditure of time and effort. And it's pushing people to leave one silo and go into a more holistic world. It's not easy. So it's going to take all of us working together to see change. Hopefully we can get some early wins, because it's like a baseball game. You want to get a single, and hopefully sooner or later you get a grand slam. So if we get a couple nice singles now, and also I had the support of my family, and especially my wife.
Well, with that, we're just coming up on 3 o'clock. I really want to thank all of you for joining us this afternoon. A huge thanks to Alan and to Phil for their thoughtful commentary and good work in this critical area. These programs wouldn't be possible without Marco and Stephanie at the Lane Center. So a huge thanks to them for making this happen. We will be sending out a recording of today's program as well as Phil's report. I included a link to Felicity Berenger's blog about rural broadband, which we would also like to share with you. It has some great and original reporting by Felicity. And if you can, we invite you to join us next Wednesday for a conversation about different perspectives on managing nature with Jeff Schwegman. Thank you so much for joining us. It's a real pleasure to be able to bring programs to you in this virtual world, and we hope to see you virtually very soon. Thanks so much.